Take five. All right, take five. Hi, my name is Bobby. I'm going to be your student nurse today. We're going to perform a wet to dry dressing change. Prior to entering the room, I'm going to check the patient's chart for doctor's orders. While checking the doctor's orders, a couple other things I'm going to take a look at: patient allergies on the chart, and I'm also going to see when the patient had their last administration of pain medication. I want to wait at least 30 minutes prior to attempting a dressing change. Now I've checked the chart, I've seen my orders, I know the patients had their pain meds 35 minutes ago. I'm going to go ahead and gather my supplies. Got my supplies outside the room, and I'm going to wash my hands before entering. My hands are now clean and I'm entering the room. Nursing, hi, my name is Bobby. I'm going to be your student nurse today. We're going to have to do a wet to dry dressing change on your wound. So I'm going to explain to the patient a couple things we're going to take a look for, and the reason that we're doing the dressing change is we want to promote a healthy wound bed, we want to promote infection control, and we want to promote healthy wound healing. By doing this dressing change, we are debriding any old material that may be in it, cleaning it up, and putting a clean dressing on there to allow for any kind of drainage that may be removed at a later time. So I've asked the patient for their name, I've checked their arm ID band, I've compared two patient identifiers, patient's name and the medical record number or the date of birth. I've checked their bracelet to double check for allergies, make sure there's no adhesive allergies or any kind of latex allergies. Now I'm going to raise the bed to a comfortable height for myself, and I'm going to position the patient where I have easy access to the wound and where the patient is also comfortable. So we raise the bed for proper body mechanics. Explain the patient procedures. I'm going to put on my non-clean gloves because this is non-sterile. I've washed my hands, put on my gloves. I'm now going to remove the previous dressing. I'm removing the tape from the outer edges, and I'm going to slowly pull the cover off because I'm not sure if the bandage is stuck in the wound. I'm going to go ahead and slowly remove the insides of the dressing. This is going to debride any material that's in it. If there's anything stuck, I may add just a little bit of saline to it just to kind of moisten it a little bit, not a lot, because I still want to debride whatever's in the wound bed. I'm going to wad this up. I'm going to take my gloves off to keep it enclosed, and I'm going to put that in my red bag without touching my red bag. Now I'm going to go wash my hands, and I'm going to come back and start assessing the wound. I'm going to put on a second pair of gloves, and a couple things that I'm taking a look at now that I'm gloved back up is I'm taking a look at the wound bed. I'm looking for any kind of granulating tissue, any kind of yellow drainage, any kind of odor that may be coming from it, any kind of pus. I'm taking a look at the peri-wound, looking for any kind of pustules, any kind of fistulas, any kind of tears or rips, redness, scarring, any edema. A couple other things that I would take a look at while I'm at this point is I'm going to take just some measurements of the wound bed real quick. I'm going to measure with my scissors width and length just for purposes later. Now I've kind of looked at it and I've assessed it. I'm going to go ahead and clean it up. And opening my surgical sponges. And I'm going to open my saline and pour my saline on my surgical sponges. I'm now going to take my surgical sponges out. The first surgical sponge, I'm going to clean the center. Second surgical sponge, I'm going to go around the outside. I'm going to take one more surgical sponge and I'm going to clean around the peri-edge. Now I've cleaned the wound bed. I'm just taking another look to see if there's anything that's come out of it. I want to take a look at the bed, make sure it's nice, bright, and beefy red. At this time, I would probably take a cotton tip applicator or a CTA and check the wound edges to look for any kind of tunneling. If there was tunneling, I would make sure I want to document that, and so for regression purposes, we would repack that at a later time. Now I've cleaned the wound. The wound is ready to be recovered. I'm going to go ahead and change my gloves. I'm going to take these off and I'm going to go wash my hands. Now my hands are clean. I'm going to come back to the bedside, and we've got our saline gauze. It's all saturated. I'm going to take two saline gauzes. I'm going to open them and I'm going to fan them out because we want to allow for maximum coverage of the wound bed and for good healing. And we're going to start inside the wound bed. We're going to go around the edges, packing any tracking that we may need to. I want to make sure I cover all depths of the wound bed. I want to get it as deep as possible, make sure all areas are covered. That's covered it really well. I'm going to go ahead and take my second gauze and I'm going to place over the top of it. I want to be careful that I don't get on the outside edge of the wound bed because this could cause any kind of maceration, which we definitely don't want. Now I'm going to take my last piece of gauze and we're going to cover the wound bed and tape down the edges. Alright. Tape here. I'll go ahead and take my scissors. And if I had gloves on, this would be virtually impossible to do. But we would make it happen. Make sure that I cover it well so there's no drainage that can get out. Now, on my piece of tape, I'm going to label it with my initials, the date, and the time the dressing was changed. Okay. Now, a couple things I'm going to do is I'm going to reassess the bandage. I'm going to make sure there's no drainage coming through on the bandage. I'm going to make sure that it's properly taped down on all the corners. Make sure there's no skin irritation from the adhesive tape. And then I'm just going to re-instruct the patient. A couple things I'm going to educate the patient about. So I'm going to ask the patient to explain to me if they understood why we did the procedure. This will give me an idea of, one, how their cognitive ability is, but also the understanding of the reasoning for the dressing change and the reasoning for keeping it clean and intact. A couple things I'm going to instruct the patient on is signs of an infection. Watch for any kind of smelly odor or any kind of pussy drainage coming from it. Let them know that the normal serosanguinous drainage from the wound is appropriate and is okay. But if it gets too saturated, at least let the nursing staff know so we can come in and do another dressing change, or redo the dressing change, or add to the gauze to cover it. A couple things that I'm also going to ask them to watch for is just around the wound edges, any kind of irritation, skin breakdown, any kind of redness, any kind of itching. Just to be aware that if that happens, to notify the nursing staff. I'm going to go ahead and reposition the patient and get them comfortable back in bed. I'm going to lower the bed to its lowest position and raise the arm rails. I'm going to make sure I put the call bell for the patient to be able to have access to call us if she needs us. And I'm going to take my gloves off and I'm going to wash my hands before leaving the room. Now I'm going to go ahead and proceed to the documentation phase. A couple things that I'm going to document regarding the wound is the location of the wound, coccyx area on the sacrum of the bottom, the size of the wound. We measured earlier the length and the width and the depth of the wound. I would take my measuring chart when I was in the room and write the numbers down. This wound was approximately 5 centimeters by 7 centimeters with 2 centimeters in depth at the deepest spot. And this information would be charted on the chart. I would chart the date and the time of the dressing change, and then I'm also going to describe the wound. I'm going to talk about the wound bed, I'm going to talk about the wound edges, I'm going to talk about any kind of signs of infection, any kind of drainage, any kind of odor that I may have smelled. I'm also going to talk about instructing the patient teaching that I did, talking to the patient about signs of infection, and that's it. Documentation is done. I've done with this procedure at the end.